If you're one of the millions of people who struggles with sleeping with pain, you've probably tried just about everything out there to get some relief, right? You may have tried heat, cold, massage, stretching, meditation, hypnosis, prescription medications, and over-the-counter medications. Nothing seems to help. The first thing that we need to do is rule out any medical causes for your pain, especially if you've got pain when you want to sleep or when you're falling asleep. Or if you wake up in the middle of the night with pain, if you've got pain when you go to sleep, it could be because of something called hypersomnia, where your body gets overheated at night, and this triggers some reflexes in your body that cause pain. This can also happen if you have restless leg syndrome. So make sure you get checked out by your doctor if that's the case. It's also if you're waking up in the middle of the night with pain, particularly if it's a sharp-shooting pain down the leg. It could be something called complex regional pain syndrome, which is a serious condition. If that is the case, please go see your doctor. However, if your pain starts after you fall asleep, then it's likely to be one of three things: neuropathic pain, myofascial pain, or arthritic changes in your spine. Neuropathic pain can be caused by conditions such as peripheral neuropathy, shingles, sciatic nerve compression, disc disease, spinal stenosis, or even multiple sclerosis. Myofascial pain is usually triggered by sustained postures, overuse, or repetitive strain injuries. And arthritis can lead to pain when the joints become inflamed or the bones start rubbing against each other. So if none of those apply to you and your pain is only when you are trying to sleep, keep watching, because I think it might be one of these 5 reasons. Reason no. 1 is that you are not relaxed enough. Now, this might seem obvious, but let me ask you this question. Have you ever noticed that you feel better when you re-distracted while you're re-lying in bed trying to sleep? Let us say you re-lying in bed and all of a sudden you hear a noise or you feel something touch you. You startle, you open your eyes, and then you find it much harder to go back to sleep. But once you do drift off, you find that the pain goes away or it becomes less intense. This is because your awareness and attention is a powerful force that can either exacerbate pain or reduce it. It's why distraction techniques work so well for some people. So if you're finding it hard to relax enough and quiet your mind, try breathing exercises, guided imagery, or even progressive muscle relaxation before you go to bed. Reason no. 2 is that you're in an uncomfortable position. Now, we know from our experience that if someone is lying in bed and they have pain in their lower back, for example, they'll often turn onto their side and put a pillow under their knees. This will help take pressure off the discs in the lower back and help them get more comfortable. Now, what we do and realize sometimes is that the position that we favor when we re-lying in bed may not be the most comfortable position for us to sleep in. For example, if you have lumbar disc disease, sleeping on your back can actually put more pressure on the disc and aggravate your symptoms. In general, however, sleeping on your side tends to be better for most people, especially if you have disc problems or back pain. Sleeping on your side reduces pressure on the discs in your spine, takes pressure off your tailbone, and helps align your spine into a neutral position. And the best position for your arms is to have one under your head and one on top of your body. Sleeping on your side also encourages your body to absorb more oxygen, improve digestion, reduce acid reflux, and even helps relieve menstrual cramps. If you do like to sleep on your back or your stomach, try putting a small pillow under the curve of your upper back. This will help take pressure off your lower back and promote a more neutral spine. I've even seen people put a folded towel under their neck to help extend the cervical spine, which can help with neck pain. Just make sure you use common sense when it comes to choosing a sleeping position, and make sure you're not putting yourself into a position that aggravates your pain. If you're unsure, consult your physical therapist or doctor. Reason no. 3 that you're having trouble sleeping with pain is that you're moving too much. We've all been there. You're trying to sleep and you keep tossing and turning. Your partner may even tease you saying, hey, you're getting some good exercise. Well, that tossing and turning can actually be triggered by pain, but it can also make pain worse. Pain can make us move around because it can cause muscle tightness, nerve sensitivity, and it can even trigger the release of adrenaline. Adrenaline makes us alert and awake, which is why you might find it easier to go to sleep when you're retired from doing something physically demanding during the day. That said, if you're tossing and turning in bed and you're already exhausted, it can become a vicious cycle. The key is to find ways to stay still. Try focusing on your breath rather than counting sheep. Focus on the sensations of your body being supported by the bed and gravity. Visualize yourself floating, or even imagine that you re one of those starfish that S attached to the seabed. No. 4. You're not moving enough. Lack of movement can make your muscles stiff and tight, which can lead to discomfort when you lie down to sleep. During the day, we're constantly moving, whether we're sitting, standing, walking, or exercising. But when we sleep, our muscles are completely relaxed. If they're not used to being relaxed, it can cause them to spasm or cramp. This is why gentle stretches before bed can help loosen up your muscles and make it easier to fall asleep. Gentle yoga poses such as downward dog, child's pose, and cat and camel pose can help stretch the spine and promote relaxation. Forward folds and seated forward bends can help stretch the hamstrings and glutes, which can be really tight from sitting all day. If you want to try static stretches, make sure you hold each stretch for at least 30 seconds and focus on your breath. If you want to try dynamic stretches, aim to perform each movement for about 60 seconds. Again, focus on your breath. If you're looking for a good routine, check out one of our videos on YouTube, 7 Gentle Stretches for Back Pain. 5. Your mattress isn't helping. An old, worn-out mattress can contribute to back pain. A supportive mattress is essential for maintaining the natural curvature of your spine and reducing strain on your muscles and joints. So if you're sleeping on an old, lumpy mattress, it may be time for an upgrade. There are lots of different types of mattresses available now, including memory foam, latex, and hybrid mattresses. These can help alleviate pressure points and provide support for people with back pain. If you're unsure what type of mattress to buy, look for one that is firm but not too hard. Medium firm is usually best for people with back pain. One last tip is to use a mattress protector. This can help prevent your mattress from absorbing too much moisture and becoming a breeding ground for dust mites. There are many other causes for pain when you're trying to sleep, and it's important to identify the underlying issue in order to treat it effectively. If you'd like us to cover some of those other issues, let us know in the comments below. I hope you found this helpful. If you did, please consider subscribing. We wish you all the best with your recovery.